On Thursday, the Health Service Commission launched an e-recruitment system for health workers. A streamlined system, the e-recruitment will help those seeking to join public service to apply for placement in the health sector online. A 2015 report on human resources for health shows that Uganda has a total of 5,418 public and private not-for-profit health facilities requiring over 60,000 health workers. The same report indicates that the country is short of about 20,000 health workers. The approved staffing norms at local government level is 50,960, whereas the national level stands at 59,232. The number of filled vacancies stands at 34,260 for local government and 40,790 nationally. 16,700 at local government are still vacant and 18,442 nationally, the same report shows. This has significantly affected the operations of available health workers due to the surging numbers of patients. The chairperson of the commission, Professor Pius Okong, says these vacancies are filled according to their annual budgets as apportioned by the ministry.
It's probably anything more than 400 million to carry out the recruitment exercise. And when the numbers go up, like suddenly we have to do validation, then it's in excess of 500 million. The
health sector saw a budget fall from 1 trillion shillings in 2016-17 to 964 billion shillings this financial year. But Professor Okong says a number of health facilities already had their recruitment budgets financed.
But they have now to clean up where there are some redundancies. Number two, to clean up when some of the workers who were appointed not long ago report, because there was a delay in appointment of these people. I mean, in giving them appointment letters and deploying them.
He, however, says that some qualified and experienced people do not prefer working with the government.
So there are many people, for example, who are undergone further training to get degrees or diplomas and postgraduate training by getting sponsors or paying by themselves. So once they complete, they may not be too eager to work for the government. So, but you'll see in the graduation list they are there. And also the terms and conditions of service may not be very good to attract them.
This year, the Ministry of Health has only availed about 700 vacancies to be filled. One would wonder why it is not filling up the positions, yet Uganda ranks high in the region in producing medical students. It is estimated that about 320 students graduate in medicine each year.
Because the advertisement was very expensive. The other problem they had was that the district service commissions did not have money to sit, to shortlist and interview and so on, because this would require a lot of time if they had thousands of applicants going through the papers.
Professor Okong says there are many training schools that have littered the market with a large number of health cadres with a similar qualification, leaving out the others.
The government has limited number of vacancies to take these people on board. And the only way you can take more is by changing how many are required in each facility. That has implications on money for paying salaries, which at present the government has not adjusted. There are other groups where the numbers produced is small. So even if you produce 5 or 10 or 15, you never fill all the vacancies.
The budgetary cuts have also had a toll on the recruitment process.
Even if the vacancies are there and the health workers are there and they want to work, sometimes the institutions do not have a wage.
According to the 2015 report on human resources for health, the government has since adopted some recommendations, including having engagements with aligned ministries like finance and public service on how best to address the human resource absorption challenges. Walter Mwesije, NTV.